Hello guys. So AN mother coming with complaint of milk secretion during pregnancy. How to evaluate? Right? My friends, during pregnancy, the level of prolactin will be at higher level. Even the level of estrogen progesterone is also at higher level. So this increased estrogen and progesterone will inhibit the prolactin, hence the prolactin action will not be there during pregnancy. So, but what happens if the mother is having uteroplacental insufficiency? Not only the circulation to the placenta is decreased, even the placental function been reduced. Hence, the level of estrogen and progesterone is also reduced. So, the inhibition over the prolactin is reduced and the prolactin acts. So, if a mother is coming with complaint of milk secretion, suspect fetal growth restriction, evaluate for gestation hypertension, evaluate whether there is any anemia complicating pregnancy which is contributing to IUGR. So you have to evaluate in terms of IUGR or fetal growth restriction and antepartum fetal surveillance with ultrasound you have to do and monitor the patient. So what else you have to evaluate if the mother is coming with milk secretion? See, milk secretion is galactoria. Galactoria you have to evaluate under two broad headings. One is it may be related to CNS, that is pituitary or hypothalamus related factor, or it can be non-pituitary causes. So first we'll focus on non-pituitary causes like hypothyroidism. The thyrotropin releasing hormone TRH has positive effect over prolactin. If the mother is having low level of T3, T4, there is elevated TRH, elevated TSH. So the elevated TRH will stimulate the prolactin, hence there will be prolactin secretion. So evaluate for thyroid, right? So the second cause, whether the mother is having CKD, renal failure, there will be reduced clearance of prolactin. So look her for a renal function test. And the third cause, if the mother has undergone any major surgeries or burns, because of the pain will inhibit the release of dopamine. And when there is inhibition of dopamine release, so the prolactin itself acts too much, hence there will be increased prolactin secretion. So these are some of the non-pituitary causes for prolactin secretion. So you ask for thyroid stimulation hormone TSH and ask whether any major surgeries been done, and this is how you evaluate. If the mother is having prolactin adenoma, so it can be in the anterior pituitary gland, that is microadenoma less than 1 cm or macroadenoma more than 1 cm, or the stalk which is connecting hypothalamus to pituitary. If there is any infiltrative lesion over the stalk, the dopamine will not act over the pituitary gland, hence there will not be inhibition and the prolactin level will be increased. So this is how you evaluate a case of galactoria during pregnancy. Mostly please evaluate for fetal growth restriction and suspect FGR, and then rule out the other causes for galactoria. Thank you.